Hey guys, welcome back to sqadia.com. We will discuss anti-anginal drugs today. Did you know that angina is not a disease, but rather a symptom of an underlying condition? But it does occur due to CAD, that is coronary artery disease. The coronary arteries supply blood to the heart. With increasing age, atheromatous plaques progressively narrow the arteries, and the obstruction to blood flow may eventually become so severe that, when exercise increases the oxygen consumption of the heart, not enough blood can pass through the arteries to supply it. The ischemic muscle then produces the characteristic symptoms of angina pectoris, episodic chest pain that may radiate to the jaw, neck, or arms, shortness of breath, or dizziness. American Heart Association have categorized angina into 4 types. Stable angina or angina pectoris is chest pain or discomfort that occurs when a part of your heart doesn't get enough blood and oxygen. It is most often just called angina. Angina can be a symptom of coronary artery disease. Unstable angina does not follow a regular pattern and usually occurs during rest. It mostly results from atherosclerosis, which involves a blockage preventing blood from reaching the heart. The pain lasts longer than 5 minutes and may worsen over time. Rest and medication alone may not improve the symptoms. Variant Prince-Metal angina is rare. Doctors sometimes call it Prince-Metal angina, and it can develop when the body is at rest, often around midnight or the early morning. It happens when a spasm occurs in the coronary arteries. Possible triggers include exposure to cold, stress, medicines, smoking, or cocaine use. Microvascular angina can occur with coronary microvascular disease, MVD. This affects the smallest coronary arteries. As well as chest pain, a person may experience fatigue, low energy, sleep problems, and shortness of breath. Microvascular angina tends to be more persistent than stable angina. It often lasts longer than 10 minutes and sometimes longer than 30 minutes. The oxygen deficit results from inadequate myocardial blood flow due to narrowing of larger coronary arteries. The underlying causes are most commonly atherosclerotic change of the vascular wall, coronary sclerosis with exertional angina, or very infrequently spasmodic constriction of a morphologically healthy coronary artery, coronary spasm with angina at rest, or more often coronary spasm occurring in an atherosclerotic vascular segment. The goal of treatment is to prevent myocardial hypoxia, either by raising blood flow, that is oxygen supply, or by lowering myocardial oxygen demand. Just for the sake of knowledge, there are 3 factors for determining oxygen supply: caliber of proximal coronary segments, caliber of arteriolar resistance vessels, and intramyocardial pressure. 3 factors of oxygen demand include heart rate, contraction velocity, and systolic wall tension. After a little introduction to angina, let us move towards our main topic, that is anti-anginal drugs.